heard so much about this Kerala model, but with the state accounting for about half the cases in our country, this draft report has raised some serious issues about standard operating procedures not being followed effectively. Contact tracing, for example, it's abysmally low, says this report, sir.
Whenever a central team of doctors or experts says something, definitely we have to take it very seriously. And definitely we have to address those issues. No doubt about that. But you look at the real data. What is meant by containment? Containment means you are not allowing the infections to occur. Which state in India was containing the second wave of COVID-19? That is very much evident from the serosurveillance report of ICMR. And Kerala significantly had lesser number of infections, just 44%, even though Kerala has reported large number of vaccinations compared to another average Indian state. What does that mean? That means containment strategy was most effective in Kerala compared to any other part of the country. That is, otherwise, what is the reason for this much low seroprevalence in Kerala? That is the first question. So that itself shows that Kerala's containment strategy is much better than the other states.
So, now, I mean, look at the disconnect then between what the state says and what the central panel says. You say containment strategy is extremely effective. The center says that's not true. But Tom Vadakkan, sir, let's take this point by point. Let me bring in Tom Vadakkan. Tom Vadakkan, Kerala's Health Minister Veena George insists that the total number of cases are below what the Kerala government describes as the medical capacity level of the state, which means Kerala is saying no one has died because of either shortage of oxygen or unavailability of either beds or medical attention. Cases may be high, deaths are low. Kerala is being unfairly targeted, Tom Vadakkan.
This is a misleading information. I've said this on your channel time and again. This whole business of managing the medical team through a PR company which puts out figures, fudges figures, and misleads people. This Kerala model was a big fraud. You may give statistics to prove that you are correct. But the point is, people who have died are witnesses to these accounts. They are dead. They can't speak. The point here is Kerala government went in for a huge cover-up during that period and continues to trail the cover-up, refusing to identify the issues despite an intervention of the Supreme Court. Now a central team has actually unveiled the truth. They won't believe it still. There's a health minister saying, well, you know, we follow the UN regulations. What is this? I mean, you compare with the other states saying your facilities are wonderful, no contact tracing, home isolation, I mean, it's a horrible situation. What is this home isolation? You have no quarantine facilities, and if you have it, it's functioning at a level where people don't want to go. So why is it so? A total failure, administrative failure. This is not about
a grave charge you are leveling, sir. There are two very major charges that you are leveling at the Kerala government.